Caroline Kitham, who will be leading the discussion. She brings a wealth of experience in the field and will be helping us unpack this topic in a meaningful and relatable way. Please feel free to engage through the chat and note that there will be a time for questions at the end. And without further ado, I'd like to warmly welcome Caroline to take us through today's discussion. Over to you, Caroline.
Thank you very much, Linda. Good evening, ladies and gentlemen. I'm very privileged to be here with you today, and I hope this discussion, or rather this session, will be as engaging as possible. Please feel free to ask any questions that you may have as we go on, and just like Linda has mentioned, feel free to put your questions in the chat, and we'd be happy to answer them at the end of the session. So let me share screen. Yeah, so we will be covering normalizing discussions on mental illness, and the objectives being to gain a clear understanding of mental health and its importance, explore what constitutes mental illness, examine why mental illness is often misunderstood and under-discussed, and also learn practical ways to break the stigma in everyday conversations. So maybe we can begin with the question, what do you understand by the term mental health, and what do you think can lead to poor mental health? Yeah, so when you hear the word mental health, what comes to your mind as the first thing? Please let us know in the chat. It's a very commonly used word, and it's also used together with other words as well, every day. So what do you think mental health is, and what do you think can lead to poor mental health? Okay, so Daniel says psychosis. Yes, that's related to mental health. What else? When you hear the word mental health, what comes to mind? And what do you think can lead to poor mental health? Okay, apart from psychosis, what else do you think entails mental health? Poor mental health? Okay. So let's see if we will get to understand what mental health is, and also what poor mental health is, even as we go on. So correct state of mind and emotions, then trauma can lead to poor mental health. Very correct, Cynthia. Thanks. Thank you for sharing that. Who else? Okay. So according to the World Health Organization, mental health refers to a state of mental well-being that enables people to cope with the stresses of life. So I'm going to add the everyday stresses of life, realize their full potential, learn well, work well, and contribute to their community. So overall, mental well-being. Okay. And as you can see, this has covered like all aspects of an individual to cope with life stresses, to realize their full potential, to realize their abilities, to learn well, so to grasp whatever experiences they're supposed to grasp from the environment, to also work well and to contribute to their community. So risk factors for poor mental health include the following. So one, child abuse, which can very easily lead to depression, anxiety, post-traumatic stress disorder. Somebody mentioned about trauma, or personality disorders. Genetics also play a key factor in poor mental health as a risk factor. And it can lead to, not necessarily, but it could lead to autism, attention deficit hyperactivity disorder, ADHD, bipolar disorder, depression, and even schizophrenia. The other risk factor for poor mental health will be our lifestyle. So Are you engaging in excessive alcohol and substance abuse? Poor diet, risky sexual behavior. We also have environmental factors. For example, growing up in extreme poverty, it can be a risk factor for poor mental health. Living in a place that has air pollution can even lead to issues like depression. Lack of social support. So if you do not have a proper support network, then this can also be a risk factor for poor mental health. Then I just want to touch a little bit on chronic stress. Stress is a word that we use every day. I'm not too sure if there's a day that I probably don't get to mention it in one way or another, because we get to experience different forms of stress on a daily, whether it's at home or whether it's at work. And so we have positive and negative stress. So positive stress could be you're preparing for an interview or you're going to do an exam. So that is positive stress. So whatever you do leading up to that stress giving you the motivation to actually read for those exams or prepare for that interview, that is positive stress. But then we have the negative stress. And so with the negative stress, so if it is prolonged, okay, so you get very stressed. It could be from a relationship issue. It could be related to work. You could be going through grief. So whatever kind of stress you might be experiencing, if it ends up being prolonged, okay, I don't want to go into the biology of it because it will be a bit complicated, and I want to make this session as simple as possible. But the way you know stress, as long as it's prolonged, it can easily lead to depression, anxiety disorders. There are people who have committed suicide, unfortunately, as a result of chronic stress. Chronic stress would also affect cognitive functioning. You will struggle with memory. You find that very basic, to remember what you ate yesterday night or what you did 2 days ago becomes a problem. Even with your learning, if you're a student and you're studying, you cannot remember most of what you might have studied. It will affect your reasoning, concentration, problem solving, and even normal thinking. Yeah. Then chronic stress, very interestingly, also has a link to our physical health. And if we allow chronic stress to, prolong in our lives, then it can very easily lead to heart disease, heart attacks, high blood pressure, stroke. These are called cardiovascular diseases, believe it or not, in as much as we easily um, sometimes don't take stress very seriously, but it can lead to all this. It can lead to digestive problems, headaches, diabetes, migraines. There is ongoing research on the link between depression and migraines, that if you show up at a hospital with migraines, then you also need to be assessed for depression because of them being comorbidities, so existing with each other. And then also you might experience muscle tension and also pain. Yeah. So as you can see, in as much as we sometimes take stress in a very light way, but you can see that prolonged stress can have very major implications on our mental, emotional, and also physical health. So why is mental health important? So we need, like I mentioned about us experiencing stress on an everyday, having good mental health gives us the ability to cope with everyday life stresses. So you build resilience. I usually look at it as with coping skills, like having a toolbox that has different, the way you have a toolbox with different screwdrivers, and this is very common with men who keep toolboxes. I don't. So you have a toolbox that has different coping tools, so that whenever you encounter a certain stress, all you need to do is to go to the toolbox, take whatever coping skill you need for that specific stress, and then use it. Okay. So building a wide range of coping mechanisms is very, very important. The other importance of having good mental health is that you will definitely have improved self-esteem. You will be more confident. You will have a positive image of yourself. You'll also have healthy relationships, whether it is at work or personal life. You will also have better quality of life. I did mention in the previous slide about how stress affects your physical health. So you would have better quality of life and even higher productivity. So you're able to work properly, be a better mom, be a better parent, be a better partner, be a better employee, be a better CEO, and your productivity in every aspect of your life is also greatly improved. So I'm going to throw this question to you again. What do you understand by the term mental illness? I can see somebody was drawing on the screen, yeah? I don't know who it was. But what do you understand by mental illness, the word mental illness or mental health disorder? Somebody had mentioned about trauma, psychosis. Yeah, Frederick has mentioned diseases that affect our thought process, often evidenced by behavior and actions. Very true. Yes, all this is part of mental illness. So mental illness or mental health disorders, sometimes they are used interchangeably, refer to a wide range of mental health conditions or disorders that affect your mood. So how you feel, okay, your emotions, okay, that affect your thinking, so your thought process, and also your behavior. So you have what you're feeling in your emotions. So you think a certain thought, it affects your emotions, and then now you carry out a certain behavior. And examples of mental illnesses include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors as well. So signs and symptoms of general mental health disorders. So they're not limited to this. And as it is, there are those symptoms that cross each other, and there are those that are very specific to specific mental health disorders. So this is just in general. So some of the signs and symptoms may include you feeling sad or very low, you feel your spirits are very down. You may be confused. You may, feel very confused in your thinking or have a reduced ability to concentrate or even remember things. You might experience anxiety where you find you have excessive fears or worries or extreme feelings of guilt that are coming out of nowhere that may not even be linked to a specific event. You may have extreme mood changes of highs and lows, withdrawal from friends and activities that you previously enjoyed. So you find if you loved watching football, you don't have an interest in it anymore. Then you want to isolate yourself from family and friends. Having significant fatigue that you can't explain where it's coming from, having low energy, problems with sleeping, detachment from reality, whereby you experience hallucinations or delusions. I don't know if anyone of you has experienced this. And then inability to cope with daily life problems or stresses. So you might experience a very minor issue and you just explode. Yeah. I usually call it, it's like killing an ant with a gun. Yeah. So you become completely unable to cope with everyday problems, trouble understanding and relating to situations and to people. So your interpersonal relationships are affected, problems with alcohol and drug abuse, major changes in eating habits. You either do not eat at all or you overeat, and even sex drive changes. You may experience low libido or very high libido. Yeah. For example, like bipolar can very easily lead to, having a high sex drive, which can very easily lead to also engaging in unhealthy sexual behavior. So all these are or can be indicators of some form of mental illness. But like I said, these ones are not specific, they're just in general. You will need a proper diagnosis from a psychiatrist or a psychologist to be able to get to know what exactly you are suffering from. So how do we cope? Very briefly, it's very important to have a support system of friends and loved ones or even colleagues at work. Your colleagues at work can also be a support system to you. Lifestyle changes, making sure that you sleep well, eat healthy, regular exercises, moderate alcohol intake if you cannot avoid it at all. Okay. Avoid smoking completely, avoid smoking and drug abuse. Practicing meditation, breathing exercises, yoga. If you have interacted with any of this, it will be a good thing to continue with it if you normally do it, or if you haven't, meditation, breathing exercises, and yoga are really, really good for dealing with stress. Um, and so some of the symptoms that I have mentioned. Then reducing screen time. Please don't be on your phone, you know, doom scrolling. What do you call it? Doom scrolling the whole night or just before you go to sleep. Of course, it's going to affect your sleep. It can also increase your anxiety levels if you are, if there's a happening going on and you are on your phone, just, checking out whatever is happening, and whatever it is triggering you. So if you have any triggers that are happening on any social media platform, kindly cut down on, you know, um, immersing yourself in too much information, if that makes sense. Okay, so completely reducing on a screen time can go a long way. Like one of the things that I do is that I mute my apps, all the social media apps, up until Friday. So from Monday to Friday, I do not get on the social media platforms on my phone. Okay. And that has really, really helped me with my sleeping, feeling more relaxed at the end of the day. So I would highly, highly encourage you to completely reduce on your screen time. Don't doom scroll. Then practicing self-care habits, getting into hobbies that you enjoy or you used to enjoy before, journaling, write down your emotions, write down your thoughts, having a gratitude list. If you can write, a list of things that you're grateful for on an everyday, if possible, either early in the morning or at the end of the day, that goes a really long way in helping us cope with stress. Then, of course, creating boundaries. If people or things are not healthy for you, please, if possible, create necessary boundaries. Okay. And last but not least, seek psychological support or see a psychiatrist if necessary. Like I mentioned, maybe it's not a good idea to go on on Google to Google certain symptoms and diagnose yourself. If you feel you're not okay, or if you know of a loved one who is not okay, kindly refer them to a psychologist or a psychiatrist for them to receive a proper diagnosis and so that they can receive proper treatment. So, mental health stigma. Who can share with us, maybe on the chat, what comes to mind when this word is mentioned, the word stigma? Have you experienced it? Do you have a loved one who has experienced it? Do you have a colleague who has experienced it? Mental health stigma. Kindly share in the chat what you think mental health stigma is. And yes, if you have experienced it, you can also indicate that as well. Mental health stigma. What do you understand by the word stigma? When people sideline you, very true, Evelyn. So the feeling of isolation and rejection, absolutely. When people see you in a negative way, when they have a negative attitude towards you, that is a form of stigma. Thank you, Dennis, the two Dennis. Dennis Achesa and Dennis Ketone. Always judging you. Stigma also comes with judgment. Very true. Okay. So thank you so much for sharing that. So yeah, mental health stigma is a negative attitude or idea about a mental health feature of a person or a group of people that then leads to their discrimination. Okay, so a mental health feature. So they could be having a mental illness, okay, or maybe a personality disorder, or whatever form of mental health issue, either linked to a person or a group of people. And then as a result, either you as an individual or the society discriminates against them. I can see somebody has written negative societal view. Absolutely. So what are the factors that cause mental health stigma? So one, we have cultural and social norms. Growing up, I'm a millennial, so I'm not a Gen Z, but growing up, it was not uncommon to call people who are outside, who are not, yeah, who had been abandoned by their families, and they were lying in the streets, had mental illness. We would always call them mwenda wazimu, and it was a commonly used word. I haven't had it in a while. I don't know if it's common nowadays because I haven't had it in a while, but during my time when we were growing up, it was very, very common. It was a very normalized word. So mwenda wazimu. Um, and I don't know what you call it in your culture. Back at home, what words do you have that are related to the mwenda wazimu word? Maybe you can share in the chat. Then with this culture and social norms, there are some communities whereby it is a taboo to even talk about mental illness. You cannot talk about mental illness. And we also have this thing whereby in most of our communities, we view mental illness as being possession by evil spirits. Or you hear somebody is being told that they are cursed. Mugoroki, yes, that was also very common during my time. Yeah, so somebody being called a Mugoroki, yeah. So very common, especially in the African context. Or this person has has demons. There are those who, but I don't want to get into the spirituality part of it. I don't want to get into that debate. But you have seen, somebody being taken to a church to be prayed for so that demons can be removed. That's very common in our African culture. And there are those who believe that mental illness is a curse. Then another factor that causes mental health stigma is when there's judgment, prejudice, and discrimination. And I can tell you for sure that stigma surrounding mental health remains one of the biggest barriers to progress in addressing this critical aspect of overall well-being. Okay. Lack of understanding and education. People are very ignorant on issues, mental health. And of course, with the limited knowledge about mental health conditions, it leads to misconceptions and stereotypes. There's also the factor of fear of the unknown. Sometimes mental health can be very complex. Mental illness can be very complex. So if you do not have a background in it, if you don't have knowledge in it, it can feel like a very big thing that has to be dealt with if a family member is experiencing it. So what do? We decide to just avoid it. We don't take them to a hospital. We ignore them. We keep them locked up somewhere. Yeah. So we completely avoid dealing with it because we feel like it's too complex to be dealt with now that you do not have information about it and you do not know that it can actually be managed, treated and managed. Then also inaccurate reporting by media, mainstream, so TV, radio, newspapers, and also digital platforms like Twitter, TikTok. All these play a significant role in shaping public perceptions and conversations that we have regarding mental health. And with that, it's not uncommon to find somebody on TikTok maybe masquerading as a mental health practitioner, but the information that they're giving is very inaccurate in terms of mental health. So we need to be aware of this, and very important to verify information that is given to us or whatever we absorb from social media, because this can be a media to bring in mental health stigma. Okay. And it's a very powerful medium at the moment. Another factor will be historical stigmatization. So how people handled people with mental illness back in the days. that we still use now, okay? There are those attitudes and certain behaviors and methods that have been passed on till now. So, for example, it's not uncommon to find people with mental illness being marginalized, being isolated. During Nazi Germany, during Hitler's time, there was sterilization and of people with mental illness, and even some were, no, quite a number were murdered, actually. That does not necessarily happen now. I do not know if sterilization happens in families. I'm not aware of, I don't know that, but it's possible that it can be happening in families right now. But of course, being burnt at the stake, which is also very common those days, I haven't seen that happen of late. So at least that's been gotten away with. But it's not uncommon to find somebody with mental illness getting locked up in a house or being changed to a bed. I think we have seen this on mainstream media, and it's not uncommon. So historical stigmatization, what used to happen before, is still carried forward, and that can still affect how we look at mental illness now. Then also gender. In some societies, women face higher stigma due to societal roles and expectations, and also vice versa. There are also some communities whereby men are actually discriminated against more when they have mental illness as compared to women. So, and with this, it doesn't necessarily mean the 47 tribes of Kenya, but I'm talking about also in other parts of the world. So with health stigma, it can greatly impact timely access to medical care and also adherence to treatment by those who are unwell. So the person who is sick is not able to access treatment on time. Okay, so they get their illness gets worse. They may not be able to access a mental health facility, a proper mental health facility, and also adherence to treatment. Because with the stigma, I do not want to be seen showing up at Mathare Hospital to get treatment. Okay. Or I do not want to be seen taking certain medications. And so with how those around us take this, if they stigma surrounding mental health wherever you are, then it can also affect your adherence to treatment if you're already receiving treatment. I've seen it's not uncommon to see, somebody sneaking into therapy to go for therapy because they don't want to be seen that they're going for therapy, or they don't want to be seen that they're going to a psychiatrist. Yet it's like for us, if I have malaria, it's very easy for me to tell somebody, hey, I'm going to see a GP at Coptic Hospital, and it's very normal. So all these factors related to stigma can greatly affect the person who is unwell. Okay. And yes, all these delays in seeking care can exacerbate mental health conditions, plus also other pre-existing conditions, leading to worse outcomes and reduced quality of life for this person. So if, for example, they have schizophrenia, they've not been able to access medical care, and they're getting worse, of course, this will affect their sleeping. Of course, this will affect their basic hygiene, and we've seen that with people who have mental illness. It will affect their interaction with the world. It will affect their going to work. They probably will not even be able to go to work. It will be very easy for them to immerse into substance and drug abuse. So, and this will lead to their quality of life, be greatly reduced. And of course, who knows, it can even lead to an eventual death of this person. And of course, stigma can also result in the misallocation of resources. So if the government is supposed to give a certain allocation to mental health, and they do not see this as being important, or the healthcare system does not see mental health to be important, then it ends up being underfunded. And of course, this ends up affecting people who would need to have access to this treatment. So mental health stigma cuts across individuals, it cuts across society, it cuts across the healthcare system, it cuts across governments. And that's why it's very important for us to have this discussion to hopefully normalize mental health for better outcomes for those who need our help. So this is just a screenshot of different cultural groups in regard to how they perceive mental illness and the impact on stigma. So amongst the Asians, for example, it's seen as a sign of personal weakness or failure of self-control. And again, this stigma leads to family shame and discourages help seeking. Again, then they end up having delayed treatment. In the African context, I've already mentioned it about it being linked to spiritual causes. And of course, this leads to very high levels of stigma and again, delay in seeking psychiatric assistance. In the Arab world, it can be viewed as a form of divine punishment. Maybe this has changed. I just got this information from a research that had been done before. It can be viewed as a form of a divine punishment, again, causes stigma, and then leads to avoidance of treatment. So this person is not able to access treatment on time. In Latin America, it's attributed to personal weakness or lack of willpower. Again, stigma is there, again, leads to delayed treatment. In the Western world, which I think we also picked, or rather when I was younger, that's how it was, because we always will perceive people with mental illness as being dangerous. So you are told not to go near them, and everybody completely isolated them. Yeah. And even being told, that they're very unpredictable, they can easily just hit you with anything. I think most of you can relate to this. And of course, this ends up resulting in them being discriminated and socially excluded. So as you can see, mental health stigma cuts across different countries, it cuts across different continents. It's not just an African thing, okay? So there's a lot that needs to continue being done to reduce stigma. It may not go completely, but it's very important for us to reduce it. So how do we break stigma? So very important, mental health education or public awareness campaigns. So for example, even having a session like this is crucial in dispelling myths and encouraging empathy and acceptance. And even if possible, you can be a mental health ambassador. If, for example, you're struggling with a mental illness or you have a family member who is, then you can be a mental health ambassador and of course, get on the social media platforms, get on Twitter, get on TikTok, get on Facebook and talk about mental health. Yeah, giving correct facts about it. Secondly, encouraging open conversations and also providing accurate information about mental health to normalize it. One of the things that I always say is that we're not supposed to separate our head from the rest of our bodies. The same way you go to a doctor to treat you for malaria, for diabetes, for hypertension, for pneumonia, we're supposed to normalize mental health to that level that it's very easy for me to tell somebody, hey, I'm going to see a psychologist or I'm going to see a psychiatrist because I feel I'm not okay. Okay. So we need to not separate literally our head from our body because that's what we do. Yeah. Where our mind is up here. And we need not separate it from the rest of our body because they all, we're all one person, not separate entities. Then challenging cultural norms and promoting a more empathetic and accepting attitude towards mental health. So if you know of any cultural practices back at home that cause stigma or bring stigma, it's okay to go and have these conversations with your grandmother, your uncle, and tell them, hey, that guy who is not okay, who is on the streets right now, we can actually take him to the hospital and he can get better. Okay. So if possible, challenge cultural norms, but of course in a diplomatic manner. Okay. Then responsible and accurate media representation. So people who are in the media world, content creators, mental health ambassadors, us psychologists, everybody who is involved in any way with disseminating information outside there on mental health. for us to have responsible and accurate media representation of mental health disorders. And actively dismantling of prejudices from historical stigmatization. I remember, like in Kenya, there was this thing whereby if you try to commit suicide, you get arrested. Yeah, if you survive, you actually get arrested. Instead of this person getting help, then you see they're put in jail. So actively dismantling this. So if you're a policymaker, coming up with friendly policies related to mental health and supportive policies. Then peer support programs, if you are experiencing or are going through a mental health issue or have a family member who is, please give each other support. Join a support group. There are different support groups. If you are near a psychologist, they probably will know a support group that you can go to. If it's dealing with if it's bipolar, if it's schizophrenia, there are support groups for all this, and this will go a long way because you get to learn what others are doing to cope. You get to see that you're not alone in this journey, and that goes a long way. Then we also have community-based integrating mental health into community-based services. So for example, at the hospital, if you're going through triage, you're having your pressure checked, maybe oxygen levels and height and weight checked, why not also add, a mental health assessment in that triage, for example? So there are countries that have actually incorporated this into standard primary care protocols. Then very importantly, last but not least, on how to break stigma is the use of evidence-based approach. There's a lot of information outside there. Just know how to filter, what to filter, and always use scientific evidence when trying to get information related to mental health. If somebody puts a video on TikTok with certain information that you feel is a bit off, please go to a scientific site, a psychological scientific site, and then just check what's there in terms of the research that has been done related to mental health. So normalizing conversation surrounding mental health would help build supportive communities through open, empathetic, and compassionate dialogue. So seeing this person who is unwell as a whole, that this is a person who, in as much as they're lying there on the streets, they've been abandoned by their people, this is still a human being at the end of the day. They still have emotions. They feel hungry. They're not able to access food. They feel hungry. If this is a person who is at home and they're getting discriminated against, look at them as a human being. Put yourself in their shoes, yeah, and be more compassionate, be more empathetic. And that would go a long way in helping us combat mental health stigma. So just as a point of reflection, just from this, this brief session that we've had, is there anything that you will do differently now related to mental health? Was there something that you were doing before that now after this session you feel, maybe I need to do this differently? Okay. Is it possible, which I have done 2 times, if you know of, I don't know, if you see somebody who is lying on the streets and they're not okay, organize for transportation, take them to Mathare Hospital. They usually accept, I have done that 2 times, okay? So I'm speaking from experience. You probably would only need to pay, at that time it was 200 bob for registration, but then the hospital would agree to take them in because you're taking them as a good Samaritan, Is it possible to even take such initiatives to help such people instead of us, shunning them away? Yeah. So what will you do differently now on issues, mental health going forward? So I'm giving you that as a point of reflection and probably as a homework, yeah, to just sit down with yourself and think through situations where or if you're the one who is going through it, or somebody who is going through it, how would you handle issues to do with mental health differently next time? even when you meet also that person on the streets who is going through a mental health issue. So I'm going to end this with the following quotes. The first one being by John Green, where he says, "We need never be hopeless because we can never be irreparably broken." Okay, so this is a statement of hope that no matter what you're going through, no matter what kind of mental illness you have, it is possible to get better. Okay, we are not irreparably broken. It's possible to get treated. And if it doesn't go away completely, it's possible to have lifetime management and you can live a normal life. Okay. Then, as you can see, I know some of you, or quite a number of you, know about this Japanese art, old Japanese art called kintsugi, whereby instead of throwing away broken pots, they actually put them together again with powdered gold, silver, or platinum. So again, we are never irreparably broken. Okay, it's possible for us to actually get fixed, get put together again. And John Ocampo, the last quote, when mental health is ultimately recognized as essential to physical health and not as an extraneous element of it, then we will have access to true, complete modern medicine because we cannot separate the mind from the body. So, so that's where I will end my presentation. And so I've shared contact details here. This is my colleague called Diana Walegwa, and the office number is there. So kindly reach out to us. And if it's getting sessions, then you will need to book an appointment. If you need to book a session for yourself or for a loved one, kindly give us a call. And we'd be happy to give you an appointment, and which can also be done either virtually or physically. So I'd be happy to take your questions. Yes, we have a few more minutes. Please feel free to ask any questions that you may have. Robert, yes, I will. Yeah, I'll send the slides to Moses, and he will share with everybody. Okay. So does anybody have a question? Can you relate in any way to what we have just shared? Do you know of anybody who is going through this? Please feel free to, you can write your experience on the chat or ask any questions that you may have. Okay, thank you, Evelyn. Thank you. Any questions? Okay, so there's a question here. Okay, so let me just read the comment first. Thanks for joining. Okay, so the Medical Professionals Association, yeah, and I know doctors, clinicians, there is a great need for mental health support, yeah. So can someone know that he or she is suffering from a mental health issue? Yes, I had mentioned, remember the slide where I had talked about the symptoms, some signs and symptoms. So if you experience anything that is out of your ordinary, now that you know yourself, yeah, if you find that you're beginning to forget more or unable to sleep or concentrate, having issues with eating, feeling suicidal, all this can be indicators that there might be an issue. And of course, like I said, very important to reach out to a professional for proper diagnosis. Okay, please do not self-diagnose and self-treat. Kindly reach out to a professional for that. So how is depression different from sadness? So Dennis, sadness can be for a short period of time. It could be linked, I don't know, maybe you have broken up with your girlfriend, for example, and of course you're feeling sad about it and you're feeling low, which is a very normal reaction. But if it's prolonged, okay, if the sadness is prolonged for, let's say, 3 weeks or more, yeah, and you get to experience sleeping issues, feeling helpless or hopeless, maybe getting some suicidal ideations, lacking motivation or energy to wake up in the morning, losing interest in things that you used to enjoy doing, having low libido, and so on and so forth. So all these can be indicators of depression. And for example, with sadness, you can be given a 3-day holiday in Mombasa or a 1-week holiday in Mombasa. You'll go there, come back feeling better. But if you're depressed, you will go for that holiday, but then still come back feeling very, very sad, very down, and the sadness has not gone away. So maybe that can be the difference as long as it's prolonged. I have this condition of lacking patience. I feel like I'm going to explode. Is something wrong with me? So Evelyn, so probably I'd be curious to know, when did this start? What's the trigger, or what was the original trigger? Is this an anger issue? And if it is, where is it coming from? What is the trigger? And were you like this before? Yeah. Or is it something that just started recently? So maybe that would help if I have other conversation with you, will be to find out all this background information. So it doesn't necessarily mean that something is wrong with you. Sometimes some of these things are just normal reactions to certain events, because maybe the lack of patience or whatever event is there that is making you feel like you're going to explode and lacking patience. If anybody else is put in the same situation, they would experience a similar reaction. Yeah. So it depends on what it is. So yeah. So Evelyn, that's how I would answer that. But definitely further conversation would help. So how can religious entities be used to lessen the stigma associated with mental health? Yeah, very, very important will be for them to first have information on mental health. I think probably having the leadership of a church being taken through a training on mental health, and then now them reaching out to the bigger church, now to the members of their church, to now talk about mental health. I hope that answers it, Frederick. Yeah, and to probably not over spiritualize everything. Like I'd mentioned, not to only look at mental health from, oh, these are demons, because in church we have that a lot, but also to think, hey, this person is unwell, and it's okay for them to go and see a psychiatrist to get assistance, even if they are a worship leader or a pastor. Yeah. How does adverse childhood effects affect adulthood mental health well-being? Yeah. Like I had on this slide, where I talked about childhood abuse. Okay, so this is not a very proper word to use, but I usually say sometimes damaged children sometimes become damaged adults. Okay, and that's why it's very important to protect children in every way, because what happens with childhood abuse, advanced childhood abuse, sometimes it gets to the point whereby it can actually cause structural changes to the brain. And the structural changes to the brain of certain structures of the brain, then it can lead to the disorders I've mentioned here, the depression, the anxieties. It can also lead to cognitive impairment, whereby you find a child is struggling in school, they're not able to grasp anything, but it's because the functioning of the brain that is linked to cognition ends up being affected. Okay. And also dealing with emotions, problem solving. So there's a whole research on childhood abuse and its effect on the brain and its implications. in adulthood. So very important to protect children. Yeah, so this is part of what childhood abuse can lead to, Robert. Then thank you so much. I've learned a lot as an upcoming psychologist. I'm asking if I can get an internship at your place. It was a really nice. Okay, I'd love to have the slides kindly. Okay, so okay, Marion, I think I will. Let me leave my my email address here on the chat. Then Marion, kindly reach out, and I'll be able to guide on the whole internship. Yeah. What are some of the interventions to support this? And in the health finance, it prioritizes. Collins, what are some of the interventions to support this? Please, kindly, Collins, please paraphrase your question kindly. So what are some of the interventions to support this? To support mental health stigma, or please paraphrase it so that I can understand it better. And even in the second section on health finance, kindly. Is this event a CPD accredited? Maybe Calgary Healthcare can confirm if this is CPD accredited. And then are there specific strategies or habits that improve mental well-being? Yeah. And they are very basic. Calgary, please go ahead.
Currently, they are not CPD accredited, but we are working on that to ensure that all the talks we do are accredited, CPD accredited. Thank you.
Okay, thank you. Thank you very much, Moses. Yeah, so are there specific strategies or habits that improve mental well-being? Absolutely. These are some of the strategies that improve our overall mental well-being, Dennis, and they're not limited to this. Everybody has their own self-care habits, their own hobbies that can be incorporated into improving their well-being. But there are basics, very important, like sleeping, eating, yeah, exercises, avoiding smoking and drug abuse. They're those that are just very basics, yeah. But if you're able to incorporate at least most of what is mentioned on this list, plus any other that you feel would work for you, then every small step goes a long way in improving our mental well-being. Whether you make a small change or a bigger change, it doesn't matter. All of it goes into improving our well-being. Okay, so any other question? So we have 5 more minutes. Collins, kindly just paraphrase your question. So what can we do to someone who refuses to seek help? Okay. I think just being supportive, yeah? Because, and depending on the situation, you may not necessarily, sometimes you may not be able to, force somebody to seek help if they don't want to. So I would say just being supportive to this person, and being supportive in terms of if they're going through their bad days, please don't be harsh with them. Just give them assurance and let them know that we're here to support you. If you want to talk, if you want us to assist you with anything, we're here for you. So just that level of support can go a long way, Cynthia. And then hopefully at some point they agree to seek help. Anybody else with a question? Yeah, comment on the role of social media and negative news and mental health. Yeah, you remember on this part where I was talking about on this how to cope number 5 on reducing screen time. Yeah, because there's just too much information that is outside there on all social media platforms. It doesn't matter what you're looking at. And of course, depending on what we are absorbing, this can definitely have a great impact on our mental health. Yeah. So, and that's why it is very important to minimize and filter the information that we are taking in from social media platforms. Otherwise, remember I'd mentioned about the whole doom scrolling, whereby you run social media for hours on end, just taking in information, and most of it will probably be irrelevant information. Then, of course, if an event has happened, there's a lot of propaganda on social media, there's a lot of misinformation on social media. So it's very, very important to try and filter what you take in. Otherwise, it can actually have detrimental effects on your mental health. So the whole, in two ways, doom scrolling, taking too much time on your screen, that has an effect on your mental health, plus also the misinformation that you take in. So take breaks, leave your phone at home, go out to nature, exercise, have a life outside of your phone and social media. Yeah, so I hope that answers it, Frederick. What are some of the interventions to support mental health victims by the government, and is it a priority? Well, that's a very good question. Like I'd mentioned, Collins, organizations like the Kenya Counseling and Psychological Association have been doing a lot, and also other psychology associations in Kenya, including the Kenya Psychological Association as well, KPA, and others, plus other psychologists have been involved in trying to come up with different policies that government can adopt to ensure that mental health is actually given priority. Yeah, so that has been ongoing. If you can check from the different platforms, if you go to KCPA, Kenya Counseling and Psychological Association platform website, then I believe you'll be able to get this information on what policies have been put in place, and there are those which are still ongoing. But for sure, major strides have been made in the field of mental health in Kenya. Major strides. Yes. Okay. Any other question? I think now we can wrap it up. Okay. So I'd like to say a big thank you to everybody for tuning in, and just put it on the last slide with the contact details in case you need it. And yeah, I'd be happy to hopefully connect with you again, either at a personal basis or again on such a platform. And a big thanks to Moses and Dr. Frederick for this opportunity. I really appreciate it. So I'm going to hand it over to Calgary Health, and I wish you all a lovely evening.
All right, thank you, Caroline, for the wonderful talk. I've learned a lot myself. And from Calgary, we wish you a nice evening. We'll be sharing the talk on our YouTube channel to everyone who attended and everyone who registered. So in the course of the week, you'll have the talk shared. Thank you all for your participation and also for keeping time. Thank you. And a good night.
Goodbye. Thank you. Okay, have a good night too. Thank you.
Good night.